So you've probably seen the headlines flying around. Former U.S. President Joe Biden diagnosed with advanced prostate cancer.
That's right. Big news.
Yeah. So we've pulled together some of the initial news reports that came out right after the announcement.
Mhm.
And what we want to do in this deep dive is just, try and understand the key information. What are these reports actually telling us about the diagnosis?
Good plan. So first off, the timing. The announcement itself, that landed on a Sunday,
Right.
but the reports suggest the actual diagnosis. That happened the Friday just before.
Interesting. And apparently he went to the doctor because of urinary symptoms. Is that what the report said?
Yeah, that seems to be the trigger mentioned in these initial accounts. Urinary symptoms prompted the visit.
It's always a reminder, isn't it? Something seemingly minor can point to something bigger. Okay, so the diagnosis itself, what did they say about the type and stage?
Well, the key takeaway is prostate cancer, definitely. And crucially, it's described as advanced.
Advanced meaning it's spread.
Exactly. The reports specifically mention it has spread to his bones. So we're not talking about an early, localized cancer here.
Got it. And there was also mention of a score, a Gleason score. What does that tell us?
Yes, a Gleason score of 9 out of 10. That came up in the report.
A 9 out of 10. That sounds high.
It is high. Basically, the Gleason score grades how aggressive the cancer cells look under a microscope. Higher numbers like 9 mean the cells look more abnormal, more disorganized.
So more likely to grow and spread quickly.
That's the general idea, yeah. Cancer Research UK, which some reports referenced, explains it that way. It indicates how fast the cancer might progress. So a 9 is definitely considered high grade.
Wow. Okay. High grade spread to the bones. That definitely frames it as serious. So what are the next steps according to the news? What's happening now?
Well, the reports indicate that Mr. Biden and his family are basically in the process of reviewing treatment options.
Okay. Exploring what can be done.
Right. Given that it's spread, you'd expect a team of doctors looking at various approaches, different therapies.
Makes sense. Now, there was one other piece mentioned, something about hormone sensitivity. What's the significance of that?
Ah, yes. That's actually quite important. The reports mention the cancer is hormone sensitive.
And that means?
So many prostate cancers, a large proportion actually, use male hormones, like testosterone, as fuel to grow. Hormone sensitive means this cancer is being fueled by those hormones.
Okay.
And the reason that's significant is that there are well-established treatments designed specifically to block or lower those hormone levels.
So it gives them a potential avenue for treatment, a way to manage it.
Precisely. It suggests that hormone therapy could be, a potentially effective part of the management plan. It's often a cornerstone of treating advanced prostate cancer.
Okay, that's clearer now. So let's just quickly recap the key points from these early reports.
Sure.
Diagnosed Friday after urinary symptoms, it's advanced prostate cancer spread to the bones, classified as high grade with that Gleason score of 9. But importantly, it's also hormone sensitive, and they're currently looking at treatment options.
You've got it. That sums up the main details from the initial wave of news. Serious diagnosis, definitely, but that hormone sensitivity is a key factor for treatment possibilities.
It certainly highlights, even for someone with access to the best care, the complexities involved. Understanding these terms, Gleason score, hormone sensitivity, it gives you a better window into what many people face with a cancer diagnosis.
Absolutely. It's a difficult reality for many.
Definitely something to keep in mind as more information likely emerges.